How to assemble and care for your clarinet. As a clarinet player, it's important to learn how to take care of your clarinet. In this video, you'll learn how to properly assemble and care for your instrument step by step. Your John Paul clarinet has 5 basic parts: the mouthpiece, barrel, upper joint, lower joint, and bell. You also should have a ligature, a mouthpiece cap, a reed, a swab, and cork grease. You'll notice that your John Paul clarinet comes with 2 barrels. We recommend you start with the shorter barrel. Your band director or clarinet instructor may recommend you change to the longer barrel as you learn to play. Before you get started assembling your clarinet, take out one of your reeds, place it flat on your tongue, and hold it in your mouth while you assemble your clarinet. Use the cork grease in your case to lightly grease the 4 corks on your clarinet. This is especially important if your clarinet is new and the corks haven't compressed yet. With your case open, identify your upper joint and lower joint. The lower joint is slightly thicker and has a thumb rest on the back. The upper joint has cork on both ends. Identify the bridge key on the upper joint. Firmly grip the upper joint in your left hand, pushing the keys that raise the bridge key. In your right hand, firmly grip the lower joint at the end without the cork. If your bridge key lines up to the other side of the bridge, you're safe to put the 2 joints together. Use a slight twisting motion as you put the upper and lower joint together. Don't twist too far, and don't forget to keep that bridge key raised. When the joints are pushed together and the bridge key connects to the other side of the bridge, you're ready for the next step. Next, grab your bell and use a gentle twisting motion to attach it to the lower joint of your clarinet. Add your barrel to the top joint of your clarinet. Remember, keep your hands close together. Hold each part as close to the joint as possible. Now, add your mouthpiece. This is easiest if you remove the mouthpiece cap and ligature first. When your mouthpiece is on, turn it so the flat part of the mouthpiece, the table, is in line with the long, skinny key on the back of the upper joint. Slide the ligature on the mouthpiece. The screws will face up on the table of the mouthpiece. Still have that reed in your mouth? It should be nice and moist by now. Go ahead and close your lips around it and pull it out of your mouth so that any excess spit is wiped off. Notice there's a thick end and a thin end of your reed. Place the reed flat on the table of the mouthpiece with the thick end pointing towards the ligature. Slide it down the mouthpiece and under the ligature. Pull the ligature down so that it sits just above the bottom of the reed. Now check your reed placement. The tip edge should be even with the curved tip of the mouthpiece. The reed should be centered on the table, straight down the mouthpiece. When your reed is in place, tighten the screws of your ligature 2 or 3 twists. We want the reed to be snug, but not too tight. When your reed is in place, you're ready to play your clarinet. John Paul prides itself on making high-quality instruments. Every instrument is quality checked before it is sent out, ensuring that your instrument is ready to play right out of the box. When you're done playing, it's important to put the reed away first. Loosen the screws on your ligature 2 or 3 turns, and use your thumb to push the reed up and slide it off the mouthpiece table. Remove your ligature and set it in the case. Find the swab that came in your case. It's a special cleaning cloth with a long weighted string. Make sure the cloth is unfolded and smoothed down so it doesn't get caught inside your clarinet. Turn the clarinet upside down and place the weighted string inside the bell of your clarinet, allowing it to drop all the way through your mouthpiece. Grab the end and turn your clarinet back over. Pull the swab all the way through your clarinet. This removes all the moisture so that your pads stay clean and dry. Keeping your hands close to the joint, use a gentle twist and pull motion to remove your mouthpiece. Replace the ligature and mouthpiece cap and put the mouthpiece away. Remove the barrel and put it back in the case. Remember, hands together, gentle twisting and pulling motion. Do the same with your bell. Before you take apart the upper and lower joint, don't forget to raise that bridge key. Keep your hands close to the joint, use a gentle twisting motion, and pull the 2 joints apart. Once everything is back in its place in the case, close the lid and zip it shut. That's it! If you remember to assemble your clarinet properly, your clarinet will stay in top playing condition for a long time. If you have any questions or trouble with your clarinet, please visit the John Paul website.